started in 2011. It is a global event to create awareness among the masses regarding vitiligo and the sufferings of the livings with vitiligo. 0.1% of the world population is suffering from vitiligo. It affects all the races. No sex predisposition, doesn't matter a man, woman, child, whatever, both sex are affected by this disease. Its age peak is 10 to 30 years. What is vitiligo? Vitiligo is a skin condition. Vitiligo is a skin condition in which pigment producing cells die or stop producing melanin. Pigment producing cells means melanocytes, which produce melanin. Melanin is the color agent, is a color producing agent in our body. If melanin dies, it means that our body loses its color. Our skin loses its color, means brown color will be lost, resulting in light or white patches. Causes of vitiligo. It could be genetic. Like some patients inherit this problem. 20% of the family have positive family history. Like in their family they have vitiligo patients already, or usually it's an autoimmune disease. It's an autoimmune disease in which it's an autoimmune disease. It means when the melanocytes are lost. Its autoimmune disease means color producing agent melanin, which gives our skin a brown color. When the melanocytes are lost, the skin loses color, leading to white patches. It is an autoimmune disease. It means the body attacks its own cells. That could be genetic in nature, or severe mental or physical trauma could be also the cause of vitiligo. But this is very rare. Effects of vitiligo. Its effect is that your skin, depigmentation on your skin, and your hair could turn white, and loss of melanin is obvious. Psychological disorders. Vitiligo is the cause of major depressive disorder and social phobia, and the patients have lower self-esteem. They have social phobias of rejection and neglection in the society, and especially when when the patches are on visible areas like face, hands, arms, and feet. It doesn't cause any organic harm, like it doesn't harm the patient. It is not a harmful disease. It's just that there are some patches on your appearance on your skin. It doesn't harm even the patient. It doesn't harm. Symptoms of vitiligo. It is very obvious. Vitiligo. We are talking about vitiligo, so it means the patches on skin, the white patches on the skin. So it is, it is an expressive disease because you can see vitiligo on the patient body. It could appear on different parts of the body, and your hair could turn white, and okay, it's a very long process. Vitiligo, it's a very long, its progress is very slow. It takes 20-25 years to grow, like um, it takes like lots of years to progress. Sometimes for like lot for like years, it doesn't, it just appears but it doesn't progress. So it appears, or sometimes it disappears on its own. Okay. Areas affected by vitiligo. It could be lip tip vitiligo, segmental vitiligo, focal vitiligo, or generalized vitiligo. Lip tip vitiligo means when your lip and tips of when the tips of fingers and toes are affected. like boundaries of lips and tips of fingers and toes are affected, then it would be lip tip vitiligo, segmental vitiligo. It's a very, very uncommon type. It is very asymmetrical and it doesn't have any, special symmetry. But the most important thing is in this type, in this form of vitiligo doesn't cross the midline of the body. It never crosses the midline of the body, and it is very uncommon form of the vitiligo. It affects area uh, in this form of vitiligo, affected area grows rapidly and then stops eventually, like stops and then stops. And focal vitiligo, it is like when the patient have like few spots on the body. It is where few spots on the body, then this is focal vitiligo. Like a small part of body is affected by vitiligo, it would be focal vitiligo or generalized vitiligo. Affects a large part of the body. It is a most common type of the vitiligo. Generally, it is considered to be autoimmune. This form is considered to be autoimmune, in which our body starts to destroy our own cells, melanocytes, which causes color in the body. It's the most common type of it, affects a large area of the body. Vitiligo have sometimes fear effects on individual's life because it's about appearance of someone. It is about appearance, because vitiligo affects different person. Like effect of vitiligo vary from person to person. Okay, some people are very strong, so they don't care about what they look like, what is in the skin. They are used to live with vitiligo. They doesn't you know It doesn't matter for them that they are like normal or they have vitiligo. Like, it doesn't matter at all. But for some, it is very they are very conscious about their appearance. They have lower self-esteem. They have the lack of confidence, social phobia, rejection, neglection in the society. They have lots of fear in terms of if people accept their appearance or not, or like uh, today is the reign of social media, and everybody is on social media and wanted to just and wanted to appear as a perfect appearance, or as a perfect role model in on social media. But okay, objective of World Vitiligo Day. Why World Vitiligo Day started? Because it started to create awareness among the masses, that so that the people can understand what the sufferings of patient of vitiligo, what they are going through. And uh, and they just want, and to make them realize they have to understand the suffering, and they have to accept their skin. It is not a contagious disease, so people doesn't have to have fear from the vitiligo patient, because it doesn't spread from one person to another. This day is dedicated to all living with vitiligo globally. Questions: is vitiligo hereditary? Oh yeah, it could be, or it could not be. As I told you, 20% of the 20% of the patients have family history, like positive family history, but in major cases it is not. Is it transmissible or to family members or contacts? As I have already told you, it is not a contagious disease, so it doesn't spread from one person to another. So physical contact is completely okay in vitiligo. It doesn't, spread from one person to another. Is it harmful? Not at all. It is not at all harmful. Are there any triggers for the disease? No. Like, not in particularly, not. No, in case of vitiligo, there are no triggers for the disease. Like, you don't have, you wouldn't feel pain, or you wouldn't feel anything unless you can just tell that you have vitiligo Then when you have patches on your skin, so there are not triggers before the disease, and there are not any particular triggers for the disease. How is vitiligo diagnosed? There are some treatments. Okay, like particular treatment for vitiligo is unknown up until now, but it can be treated like there are some medical treatment, like there are some medicines or things, and it could be through surgery it can be diagnosed, or through tattooing, through counseling it can be. How can vitiligo be treated, and what are the chances of recurrence? Oh, that's a very good question. Okay, vitiligo can be treated effectively if a person consults a dermatologist, or proper treatment with regular follow-up increases the chances of social phobias or a lot of effects vitiligo has.